That's your phones. That would be excellent. We were, Mr. Chairman? All right, I'm going to welcome up to the dais Commissioner Keeger.
Thank you, Adam. Good morning, and thanks for taking time to join us today. I'm Commissioner Tom Keeger, representing Gastonia Township on the Board of Commissioners. We're going to have a few folks deliver remarks, and then our Public Information Officer will come up to the podium and open this up for questions from the press. At this time, if you would indulge me, I'd like to give a little reflection. Some may call it a prayer, but in these times, it sure can't hurt. If you would, God of infinite mercy, hear our prayer. In this time of bewilderment and fear, we ask you to give us the courage to take care of one another as Jesus did. For those who are ill, especially those who are frightened and alone, for those who cannot access health care, for those who are homeless and lost, hear our prayer. In the midst of our sadness and grief, we ask you to join us, words to comfort one another. For those who are dying, for those who have already died from this virus, for those who tend them, and for those with no one to tend them, hear our prayer. In the midst of our own anxiety, we ask you to give us the courage to support one another as you would. For those who are unexpectedly unemployed, for employees who share what they can, for our government and financial institutions, and those who lead them, hear our prayer. In the midst of our growing awareness that all life on earth is connected, we ask for the heart to respect and cherish all life, that all peoples recognize that we are all your children. Please hear our prayer. We trust in you and your power working in us. Please hear and answer our prayers. Amen. Thank you. I have behind me Chairman of our Board of Commissioners, TRACY PHILBECK, our County Manager, Kim Eagle, our Director of Health and Human Services, Mr. Chris Dobbins. We also have Melanie Moody and Amanda Davis from Ellie Mae's Bake Shop right here in Gastonia. They're here to share a little bit of their experience of how difficult it's been trying to keep their business afloat under the current instructions. At this time, I'll ask Chris Dobbins to come on up, give us a look of our data and the progress we've made in our fight against the virus. Chris?
Thank you, Commissioner Keeger. Good morning. First, I'd like to take this moment to thank our first responders, our healthcare providers, our public health and our social services staff, and all of the essential workers who have been a part of Gaston County's response to this pandemic. I'd also like to offer my deepest sympathy and support to the individuals and to the families who have lost loved ones, and to those that are currently in the hospital or at home fighting this virus. Secondly, I'd like to say thank you to our community. You trusted us, and by following the state of emergency directives, and by staying home and practicing social distancing, and by putting your neighbor before yourself, you have accomplished exactly what we had hoped. You have protected the health of our community. You have flattened the curve, and you have helped to maintain our hospital's capacity to serve. We could not possibly have achieved all of these milestones without you and without your support. I know this has not been easy. I grew up here. I live here. And seeing our community suffer is truly heartbreaking. I know we're all looking forward to getting back to normal. I know it can be frustrating, but all it takes for me is a text from my son or a call from my parents who live here to remind me how important it is to stay the course. About a month ago, I stood up here and I used the word social caring. I had no idea at the time just how much social caring this community would demonstrate. Whether it's our churches feeding hundreds of families, our neighbors picking up groceries and prescriptions for the elderly, initiatives to take care of our homeless, the incredible display of support that our healthcare workers have been displayed, the hundreds of thousands of dollars that have been provided to families through Gaston Cares Fund, and recently, the implemented Small Business Bridge Fund. I have never been more proud of a community. The good news is that what we are doing and what you are doing is working, and we are cautiously optimistic that we will continue to move in the right direction. We'll also continue to work very closely with our leadership, our hospital system, our healthcare providers, and to share data in making the best decisions possible for our community. The health and well-being of our community is priority one. We are better together, and thank you again for the trust that you have shown in your leadership and staying the course. Next, I'd like to introduce our county manager, Dr. Kim Eagle. Ma'am.
Thank you, Chris, and thank you all for being here today. I would like to say that this incredible team that you see assembled here has worked for weeks to ensure that we remain proactive and that we bring collective expertise together from our health officials to Caramont, emergency management, and staff as we plan, monitor, and lead through these unprecedented times. I could not be more proud of the way our staff in Gaston County has stepped up to this challenge. We've persevered, and we've continued to serve the citizens of Gaston County in a commendable way. As Chris mentioned, we've served our residents in their most desperate hour. Our care plan, to date, has provided nearly $300,000 in direct aid to our residents impacted by the virus. That's nearly 350 applications approved, with another 266 still under review. And the calls keep coming. Our small business bridge loan program, approved by the board last night, is already accepting applications. Our hope is to keep small businesses afloat now as they deal with their continued bills while having a severe drop in revenue, or in some cases, a loss of revenue altogether. We've come up with creative ways here in the county to make sure we meet these unique challenges. We've been working with the county attorney as well, and he has drafted an order that will be shared today. I have engaged all of our managers in our municipalities, our towns, and our cities in Gaston County to ensure we're all on the same page as we support our community through this process. As mentioned earlier, we have a small business owner here with us today. Amanda Davis from Ellie Mae's Bake Shop will come up next and share her personal experience working through this virus and the impact it's had on her business. Amanda?
Good morning, and thank you for the opportunity to speak on behalf of all the small businesses that have been affected by the shelter in place. My name is Amanda Davis, and my brother Andrew Moody and I own Ellie Mae's Bake Shop. I began this business 8 years ago after working for several big retailers in their bakery departments. My desire was simple: to make a better, fresher, made-from-scratch baked good. I taught myself how to bake, and after 3 years, Ellie Mae's Bake Shop became a reality. What began in my kitchen grew over the past 8 years into a thriving bakery. 18 months ago, we began looking for a retail storefront, as we once again had outgrown our working space. We moved into our current location in January of 2019. We have continued to grow and have met amazing people over the past 15 months. We were once again growing and thriving. When the coronavirus pandemic was announced and shelter-in-place orders were issued, our revenue was impacted immediately. People have lost their jobs and been laid off. The choices that have been made concerning their families unfortunately impact their spending choices. When faced with the decision to buy groceries or treats such as cupcakes and baked goods, of course, food for meals have been a priority. Bakery items are a treat and optional. As a result, our revenue, as expected, dropped drastically. The result has left us with the hard decision to close our retail storefront. Like all small businesses, especially during the first year of a retail location, we did not have enough resources to sustain an extended period of shelter in place. We are friends with many small business owners, from gun store owners, barbers, florists, and other bakeries. They are all struggling to stay in business. There are not only the problems associated with the loss of revenue, we have struggled to even find basic supplies. When baking from scratch, we don't have any stored mixes to help. flour, butter, sugar, all have been either completely unavailable at times or limited in quantities. We were even told once not to come back to a major retailer expecting to buy our needed supplies in the amounts needed. As small businesses are at their breaking points, we are hopeful they can hold on. We are blessed to be a stable, growing company, and although we are having to close our retail location, we are blessed to remain in business. We are fortunate with customers who will continue to allow us to serve them. There are others who are feeling this impact as well, further causing small businesses, especially ones like ours, to struggle. Brides and grooms are forced to cancel weddings, venues have closed, churches are closed, baby showers, birthday parties, graduation parties are all being canceled or reduced to very small family-only gatherings. This affects bakeries, caterers, DJs, florists, and other small businesses who help put these events together. We appreciate the opportunity to voice these concerns today. Thank you, and we pray that those who continue to struggle can hold on until the shelter in place can be lifted.
Thank you. Let me begin today by saying thank you to the leadership teams of Caramont and Health and Human Services, as well as county staff. By working together, we have flattened the curve in Gaston County and assured our hospital maintained steady capacity. This could not have been accomplished without our citizens taking an active role in social distancing, limiting gatherings, and just overall being more aware, health conscious of COVID-19. In the early days of this pandemic, you trusted us to limit gatherings. You trusted us when we said certain businesses needed to close. And you trusted us when we decided to place a stay-at-home order in effect. These decisions were not easy. They were difficult. They were grueling, because for every action, there's a reaction. So every decision that was made, it helped someone, but it hurt someone else. They were not popular. In fact, Gaston County was on the leading edge of protecting their citizens, not just here in Gaston County, but across the state. And today, our hospital capacity and number of confirmed cases prove that. Now that we are smarter, we have better data, and are able to get our legs under us, we are asking you, our citizens, to trust us once again. The same team, the same leaders, Caramont, our health department, county staff, looking at models throughout the country and the state, the same team that helped guide us into being proactive and help us lead the state is the same team that I believe you can count on to help us move out of a stay-at-home order. We do not believe our local data and our healthcare system capacity supports a stay-at-home order in Gaston County. We do not believe that one size fits all, and we do not believe that all counties should be treated the same. In fact, we believe a continued stay-at-home order in Gaston County will have disastrous effects on our citizens. For truly, the cure may be worse than the disease for a great majority of our citizens. Thousands are out of work. The promised government assistance is slow and inadequate to meet the needs of our people. The health consequences, the mental health consequences, the economic consequences will destroy our lives and our ability to take care of ourselves. And if we continue to go down this path, it will literally be a point of no return. As I've talked to many people throughout Gaston County, from businesses to churches, I want to be clear on something.
I do not think anybody has the right answer. Whether you're the president, whether you're the governor, or even down at our level, a county commissioner. I think there's many different views on this subject. However, if we stay with the premise that got us here, and that is protecting hospital capacity, and you trusted us when we gave you that information to do that, I would be derelict in my duty if I got up here and continued to support something that the data, the capacity does not lend itself to. And if we did that, at some point, you would realize something doesn't add up. I want you to know that protecting health and putting people back to work is not a binary question. You can do both. We have learned that social distancing works. We've learned that with strict sanitation, strict hygiene, it works. We believe in Gaston County that we can do both. We can protect the health of our citizens while at the same time putting our citizens back to work. The same way that you've trusted us, Gaston County leaders trust you to practice social distancing, strict sanitation, and hygiene. Today I plan to sign an order, and you will see in a document with that order where Gaston County leadership supports the reopening of Gaston County. And that phase will be effective April the 29th, tomorrow at 5 p.m. Staying at home is not a solution. Long term, that doesn't fix anything. I thank you for trusting us to do that at first. But with more data, looking at the new models, we believe that we can do this in a safe way. Good leadership and good governance requires us to act on the best interest of all the citizens of Gaston County, those that are at high risk and those that are not, those that work for someone, employee and employer. As a commissioner, we don't get the luxury of being myopic and just focusing on one side. We represent the entire county, and there will be people that support what we do and there'll be people that don't. But in our view, and all the information that we look at, we have to make the best decision for the greatest number of people. With that said, we fully understand that supporting our businesses to get back to work does contradict the governor's order. We get that. However, that decision did not come easy. I don't know if I can tell you the countless nights of hearing people call and losing their business and everything that they have. Or on the other end, having a friend that I knew pretty well die of COVID-19. The pressure and the pulling from both sides is real. But here's what I believe. If we continue the stay-at-home order, it will not have a good effect for Gaston County. And we will not, maybe at all, have anything to come back to. Good leadership sometimes stands up to bad decisions. And for Gaston County to be treated like all other counties, to be treated as one size fits all, and looking at our data, talking with our health department, talking with Caramon officials and our capacity, it does not warrant a stay-at-home order. We can protect health, we can put people to work, and do that at the same time. Thank you.
Thank you to the chairman. What I'd like to do now is open things up for questions. We have our deputy PIO, DeAndrea Bradley, so she's monitoring our WebEx. So if we have people on the WebEx call that want to be able to answer questions, go ahead and kind of signal to her, and we'll get those questions answered on your end. We're going to start with those in the room, however. Let's go with Ken.
Yeah. So, Tracy, if you're a police officer on the beat, you know there's a stay-at-home order. We've seen people arrested in Raleigh. We've seen people arrested in other cities. And you know people are not social distancing come the 30th. What do? Do you obey the order of Gaston County, or do you obey the state's order?
I think you've seen from the very beginning Gaston County's response to our own order before anything was in place was that we would work with citizens to self-police. I think what you will find throughout Gaston County as we go forward is that our law enforcement will continue to work with citizens to self-police. When it comes to if you can maintain social distance and practice proper sanitation, proper hygiene, I think that's good self-policing.
But what about that officer and their duty to the public? I mean, you're signing an order right now, but that isn't necessarily an ordinance or a law. It doesn't supersede, as we understand everything to be laid out, it doesn't supersede the strictest guidelines, which in this case would be what the governor said about.
If you look at the governor's order, he says that local authorities will enforce. Will define enforcement. That can mean a whole host of things. For example, speeding's against the law, but not everyone gets a ticket. Enforcement can simply mean, here's the rules, wanted you to make you aware of those. So enforcement can mean a whole host of issues or different things. So in Gaston County, if you look at between March to the date that we're in now, we haven't had to have, they have been churches that had service. They've been businesses that's opened. And again, because they've practiced social distancing, proper sanitation, and proper hygiene, I don't think that there's been an issue. The message is not the Gestapo's coming after you. That's not who we are. We're not communist China. We don't want people to call on their neighbor, and we're not asking the police to search down people. People have to work. People have to pay their bills. And if you're working and you're trying to pay your bills and you're social distancing and you're practicing proper sanitation, I think that's a good start of self-policing.
So based on what you guys are doing today, based on the order that you're gonna sign today, what do the laws look like tomorrow? What is Main Avenue look like tomorrow? Who's going back to work? Is it anybody who feels like they can go back to work under what restrictions or requirements or limitations? Is it just everybody open the doors and go back?
Here's what we're doing. We're giving citizens an opportunity to make a choice. The governor denied them an opportunity to make a choice. We're not going to do that. If you don't want to open your business, you don't have to. If you don't want to open your house of worship, you don't have to. If you're in a high risk, and you don't feel comfortable going outside or being around other people, by all means, you don't have to. But you'll also have a choice, instead of waiting on a government assistance that still hasn't arrived, to make the decision to go back to work and do so in a safe manner. So I don't really know who will open up or who will close, but I trust their citizens, and I trust that they will take COVID-19 very seriously. And I just think we have a great opportunity here to get people back to work.
Let me ask another question, and that is, we see a lot of movement going on across the country with the reopening. Do you worry at all that a step like this may open the floodgates for people throughout the state and around the country itself to take their own preemptive action and do something that may not be in the best interest of the public?
I can't speak for what other people do across the country. Here's what I can tell you. Gaston County was the first to limit gatherings. We were the first to look at businesses and say, hey, can you help us by shutting your business so we don't spread this disease? Before the state did a stay-at-home order, we did. So this idea that the gods of Washington and Raleigh are all-knowing, if we would have waited on the state and I cannot say this enough, our numbers would have been higher. Our deaths could have been more because of your hospital, the leadership of Chris Dobbins at our health department and county staff. We were able to get ahead of that issue. So that's who I came to this dance with, and that's who we're going to leave with. Good, solid, trusted leadership. That does not mean that numbers won't spike. If we do more testing, you're going to see more numbers. But more numbers is not the canary in the coal mine. It is hospital capacity. So when we started a stay-at-home order, it was strictly making sure that we could deal with the capacity at our hospitals. So numbers will go up, numbers will go down, it'll fluctuate. Our concern is what part of that number requires hospitalization. And to date, across the state, there is not one hospital in the state of North Carolina that has one issue with capacity. Even in your major metropolitan areas that have dense population where their numbers are extremely high, they have no issue with capacity. In fact, we see hospitals going bankrupt because they can't afford to stay closed and running 70 to 80% capacity. So the data and the capacity does not support a stay-at-home order in Gaston County.
Let me ask another question, and that is in regards to the data.
Mhm.
We're hearing this, scientists are saying, basically what you really want to do is you want to be able to get as much testing as possible done to understand exactly the impact that this disease can have on the community. At last check, Gaston County didn't have 10% of the county tested. What are we going to do to make sure that we have that accurate data? Do we have enough data right now to take this action safely, take this action?
Yeah, basically, we've already upped and ramped up our testing. But the question that you're asking is, if we don't have enough tests, is it safe to do what we're doing? Yes, because that's not the test. The test is hospital capacity. As far as state of emergency and stay-at-home orders, as far as learning more about this disease, as far as tracing and trends, those things will continue. And as we do that, that will help us learn more about the disease. But as far as a stay-at-home order, where government's involved, the premise of hospital capacity no longer warrants a stay-at-home order.
So again, you're going to sign this order today to be effective, is it tomorrow?
April the 29th, it'll be effective today? It'll be effective today at 5 o'clock.
Today at 5, so today at 5 o'clock, if I own a business and I feel I can open up reasonably, we're open.
If you own a business in Gaston County and you can practice social distancing, strict sanitation, and proper hygiene, your Gaston County Commission supports your decision and your right to go back to work. We base that off of hospital capacity.
Commissioner PHILBECK, the executive order, it says, this order from the county is once state level restrictions found in the governor's executive orders are relaxed, the governor extended his order until May 8th. Is this just a way, literally contradicting and saying we believe we know our situation better than the governor? Because that's what I'm trying to figure out here. If this is supposed to be when it ends.
Okay, what is your question?
Why are we doing this if you're mentioning in the order that once state restrictions end, but state restrictions have been extended past April 29th?
Correct. That is a legal document that certain parameters have to be put in place. What we're doing today is letting our folks know that we support them going back to work.
So trying to understand the legal parameters versus the practical parameters,
Mhm.
because you're saying this order, you guys are going to follow the White House once the state order restrictions are finished. You're saying this order is taking effect tomorrow when the governor has extended his order for 2 weeks.
Oh, yes, there's a contradiction. But we, as elected officials that represent the citizens in Gaston County cannot continue to wait on the government because our people are hurting. We've got people that that filed for unemployment day one that still can't get it. I still get phone calls of people that still can't get on the phone. Here's the problem. If you're gonna issue a stay-at-home order, then you're also gonna have to meet the needs of the people. The needs of the people have not been met, and there's huge contradictions in the order. In one area, he says it's okay for you to open your businesses, but non-essential businesses cannot. However, if you can social distance, practice strict sanitation and hygiene, you can go to work. So that part of what we're telling their citizens to do doesn't contradict his order.
The concern also is this idea of, and there's been discussion about this, is of a double hump, if you will. Once we're seeing things are working, we're going to start reopening, and then we'll see a spike in cases. Was there any concern about that from the county, and can the hospital handle that?
Absolutely. Every scenario that you can imagine is played out in our minds, from the health director to Caramont to county staff to emergency management to law enforcement. There's no expectation that we're going back to normal. What we're trying to do is this: the data and the capacity issues does not warrant me coming out here and giving our citizens a narrative that doesn't exist. It doesn't. Our people need to go back to work. As we see numbers ebb and flow, I can assure you the same team that got us here, the health department, Caramont, and others, will follow that data, and as we need to expand or contract, we will do so to meet the need in real time.
County commissioners believe they are legally justified in this. Is there any concern about the state coming down and trying to put through court proceedings and spending money on that? Is this legally justified that the county can do?
I think it is justified for any elected official to fight for the citizens that it represents. We have citizens that are scared to death of COVID-19. We have citizens that have a lot of underlying health issues that we have to protect those. You have citizens that are perfectly healthy, that have lost their homes, their jobs. They don't have access to health care. You have major mental issues going on in their community. You have major economic issues. Our job is to stand up and support that. If the governor wants to come to Gaston County with the big heavy-handed approach of government and tell these small business owners, this bakery shop, you can't go to work. You're going to have to stay at home. But we're going to allow the multi-million-dollar special interest groups, we're going to give you the opportunity to work. We're going to allow you to go to Walmart. Has anybody been out to Walmart? They're all over each other. You can go to Lowe's. You can go to Home Depot. You can go to the banks. You can go to every bit of that. So for us, it's not a legal question. It is a moral question. Does your county commission sit back and push a narrative that the data doesn't support and that we do not believe in, or do we take a stand for the citizens that we represent by protecting their health and making sure people can get back to work? The government's response has been disastrous, and we have an obligation, a moral obligation, to do that.
Let me bring up our county attorney, Jonathan Sink, who was instrumental in crafting kind of the legal document behind this, and he can speak a little bit to your question on that side of things, Brandon.
Any follow-up on that?
Yeah, just wanted to ask specifically the legal justification, because obviously the state executive order is going on for extended another 2 weeks. This county is clearly contradicting. Is this something that the state government can go in and say, hey, this is not good, we're going to take legal action? Is that something that we have to worry paying about?
Well, I won't play the role of prophet and, to the chairman's point, say that the governor is definitely going to come down here or definitely going to try to sue us or take action through his legal staff against us. What I will say is I do not agree with the premise that it's just patently contradictory. When you look at the actual order, when you look at the 5 pages of those documents, and especially page 1, we readily acknowledge that the state executive order is still in place. So that is something that was very important to us throughout these meetings and crafting this document to let the people know, hey, the governor's executive order, all the restrictions found therein, the most recent one, 135, is still very much in place. But when you read our coinciding document, Gaston Promise, and we'll be sure to get you a copy of this, it says exactly what the chairman has already stated, and that's that, look, we hear you, 25-year barber in Cherryville. These elected officials hear you, that if another day goes by, you are closing your doors. And so it does go back to the president's comment about the cure being worse than the virus. And so this commission, these 7 elected officials have come together, worked together with staff, with senior leadership on down, and said, you know what? You've got free will as a business. We can't give you personal legal advice as a business. What we can do is we can say, look, if you open, we're behind you.
I know you can't play prophet, but as an attorney, I'm sure you're preparing for the possibility of something action. I assume you have arguments ready to go.
We do, and we haven't foretold what all our arguments would be, but we certainly recognize that within our own Declaration of Rights, within our state constitution, atop all of them is the right to enjoy the fruits of one's own labor, i.e. the right to work, whether that's at home or in your business. And secondly, and really not less important than the first at all, is the right to worship as you see fit, according to conscience, without interference whatsoever. Whatever is the word in the state constitution, actually, but it means whatsoever government might do. And so it is time, in this body's opinion, to allow citizens to corporately worship with those social distancing practices, with those sanitation requirements, and with the maximum capacity standards that you'll also see outlined and defined in these documents. And what's interesting is when you really read the documents, and again, I'd encourage you to read both of them, the things we have put in place that the chairman's already stated, the strict 6 foot or more social distancing requirements, the sanitation requirements, and the maximum capacity is almost a copy and paste verbatim from the governor's administration's own letters that are going out to businesses that ask the Cooper administration, hey, this is what I do. Can I open my doors for business? And so it's really a copy and paste. I think you'll find that interesting from the Department of Revenue to these businesses.
But you said, you spoke in regards to barbershops and 25-year barber going back. In the rest of the state, until the 8th, at least until the 8th, if not longer, that barber can't go back. That's a difference in Gaston County that you don't see. And in this case, that's something different in the governor's order. Is that correct?
Oh, I think the chairman has readily acknowledged that what the commission is saying today is not exactly in lockstep with the governor's order. But what you're finding the governor's administration itself doing is stating one thing in an executive order and practicing another through the Department of Revenue, allowing, and we haven't seen a denial letter to date back to one of these businesses. Anybody who has asked Secretary Penny of DOR has received a letter back as far as we have seen and been allowed to open. So that's the point.
Well, I mean, we have the spreadsheet from the State Department of Revenue, and it shows denials from, including businesses in Gaston, salons and places like that, firm denials. Are we seeing, it's just, I think we're trying to figure out this kind of, whether it's a contradiction, as Trace said, and now we're being told this is word for word similar, so trying to figure out.
It is a contradiction. I want to give you 2. In the governor's order, it plainly states that gyms are closed. I got a letter yesterday from a friend of mine who owns a gym. We've been working together, and he's been closed for 5 weeks. He said, there's nothing I can do. The order says that gyms are closed. I said, go file for an essential business. He got his letter yesterday. He's an essential business. Let me give you another one, a vape shop. The owner was told you cannot keep your business open because it is against, you're not essential, it's against the governor's order. They applied to be an essential business. Do you know what the order said? You are not an essential business according to the governor's executive order. Verbatim, that's what it said. However, you can remain open if you will practice social distancing, strict sanitation, and strict hygiene. So what you have, this idea, someone asked me, well, if you do this order, will it confuse people? I'll tell you what's confusing. What the governor of North Carolina is doing. He is saying COVID-19 is, we're going to have disastrous consequences and you have to shut all of these businesses down. But then the Department of Revenue, who works for him, is opening up all these types of businesses that directly go against his own order. It doesn't make sense. So what Gaston County is going to do is clarify that. Here's the clarification. Go to work. Practice social distancing, strict sanitation, and strict hygiene. Not only that, there are huge constitutional considerations when you look at the governor's order. By statute 166, he has to have the concurrence of the Council of State to do what he's done. The vote was 6-3 against what he's done. So when you ask the question, is Gaston County, are you legal? Legal scholars have told me that we don't even know if his order is legal. A federal judge in Kentucky ruled against an order just like this that set up different restrictions for a church and businesses. So you can go to Lowe's and have this many people as long as you do A, B, and C. You can do that at the vape shop. We can open a gym, but you have a whole different set of restrictions for the church. A federal judge has already ruled that is unconstitutional. So when we're talking about authority and we're talking about legality, there's a huge question of, is what the governor's doing even legal? So I just wanted to share that with you. I think Commissioner Kieger has a comment.
Thank you. I just wanted to lend a hand, and Mr. Lemon brought up at the beginning about distancing and crowd control. And in the document that evidently maybe you have not received it, I just want to go over a couple of bullet points regarding that issue, Ken. For vulnerable individuals should continue to stay at home. This is our order that the chairman will sign later today. Should remain at home. Members of households with vulnerable residents should be aware that by returning to work or other environments where distancing is not practical, they could carry the virus back home. Now, bullet point on all individuals. When in public, parks, outdoor recreation areas, shopping areas, should maximize physical distance from others. Social settings of more than 10 people, where appropriate, distancing may not be practical, should be avoided unless precautionary measures are observed. And then social gatherings, this will be in the Gaston County order. Individuals should continue to avoid socializing in groups of more than 10 people in circumstances that do not readily allow for appropriate physical distancing. Employers should continue to encourage telework wherever possible and feasible, with business operations phasing back, and employers should try to eliminate areas where employees typically congregate. And then the last thing I'd like to say on barbers, beauticians, and it's also in the county order, beauticians, I think nail salons, barbers, their license come through the state. And it clearly states in the order, in addition to local and state level restrictions, those individuals and businesses licensed through a state board are strongly encouraged to follow the directives of their respective licensing authority. So,
Can you do me a favor? Show me that sheet again. I want to make sure I'm on the same page.
Should have it. It's in the order.
It's in the order.
Let me add something, Ken. You asked about barbershops and salons. And we just got finished discussing how confusing the governor's order is, and that those salons and barbers report to a state board. We have barbers, 2 in Gaston County, that applied for an essential business, and they are allowed to open. That is the dichotomy. You look at the governor's order, it says you can't open, you have to be closed. All of these businesses have lost thousands of dollars over this confusion. And now, people that apply, a barber, a gym owner, and a vape shop, and the vape shop was told that they were absolutely deemed unessential, but were given an exception. That's pretty confusing to me. And that is where leadership, Gaston County leadership, is stepping in and clearing the way for that. When you have NASCAR getting a special carve-out so they can go to work, and I like NASCAR, but they're going to be all over top of each other working on these cars. But the bakery, the lady that started her business 18 months ago, worked her whole livelihood, you got to shut down? It's not right. It's wrong. It doesn't pass the smell test. And the elected officials in Gaston County are no longer going to stand for that kind of stuff. We're going to put our people to work. We're going to do so in a health-minded way.
Restaurants and bars with indoor seating, is that covered under this as well?
In our order, if you can practice social distancing, strict sanitation, and hygiene, we support your right to work.
And again, what you're not recommending, you're not saying go file and become an essential worker, even though it's easy to do so. Go file, you're saying Gaston County saying, oh,
Here's what we're saying. Go file, but in the meantime, you can go to work. That's what we're saying.
What is the gym that's open? I'd like to go get some photos there.
I'll get with you after this.
and you probably know, I know because you had the attorney speak, and the attorney wasn't here before, there will likely be a firestorm of a response behind that. Your thoughts on that?
I think no matter what decision we make is a firestorm. The same people that fought against, listen to this dichotomy. I've had people fight against the stay-at-home orders and what we were being proactive at first are the same people now that don't want to open up. So again, you're going to have that. But good leadership and good governance has to see maybe something that others don't. And here's what we see and what we're not talking about. There are individuals in our community that cannot have essential surgeries, that could very well die or their health be in a whole different state. There are individuals that need elective surgeries. Elective sounds good, but there's an individual who's had cancer. He needs an endoscopy just to do some tests. They're not able to do that. Those are huge issues that our healthcare system's not even being dealt with. The mental health aspect. I can't tell you the calls of people that feel like they have no hope and they're looking to government or somebody to help them. And I'm just a firm believer that we're Americans. We can be self-sufficient. And if government, in the instance of people working, will get out of the way and work on what we can do to protect the health of our citizens, will be a good thing for our community. We're not Charlotte. We're not Wake.
Talk to us, it's been at least a week since we've had a death, is that correct?
I don't have the exact data on that.
Yeah, at least a week?
Several weeks.
All right. What would you say if we do take this order, somebody ends up contracting because of exposure due to this order and dies? What do you say to that individual's family?
It would be devastating. I don't think there's no one that wants anyone to die. But what do you say to these businesses that continue to close and people continue to die from COVID-19? My point is that there's a lot that we cannot prevent. If The stay-at-home order is not going to 100% prevent someone from dying of COVID-19. It's not going to 100% prevent anyone from getting infected. It's just not going to happen. What we're trying to do is the reasonable test. Let me give you this example. The governor's order, in our view, is extreme. It doesn't have any solution other than go home and stay at home. Then you have groups that say, let's open everything up tomorrow and we're going to just be back at the new normal. That is extreme. Gaston County is middle of the road. We believe with proper social distancing, strict sanitation, and strict hygiene, we can help put our people to work and at the same time protect their health. People are going to die. You can't account for every risk over everything. So we believe by taking this approach, we will limit infections, we will slow deaths, and we'll also get people to work. If your hospitals continue to lose hundreds of thousands of dollars, you're not going to have a hospital to treat COVID-19 patients. The Hospital Association sent a letter to Congress, well actually I think it's the State House, and they want $1 billion to help keep them in business. Novant, Atrium, and Caramont are all going back to essential and some elective surgeries. So that should tell you all you need to know. If capacity is the major issue, why are they doing that? Because they don't have the capacity and they can't continue to bleed out, or you're not going to have a healthcare system to protect its people.
One more quick question, especially when it comes to schools. A couple viewers have asked just now about concern about daycare, especially when people are being encouraged to go back to work. Is that something the county is considering or offering to help or anything like that in terms of looking out for children and parents since schools are so closed?
I do think there's some daycares open and things of that nature. I think it's like anything else. I think if parents are going to have to find somebody to watch their kids, get a proper daycare, and as long as that organization will social distance, practice proper hygiene and sanitation, I think they'll be okay. Oh, if you'll look in our care plan, we actually set aside money to help those individuals with child care that are having issues based off of COVID-19. And afterwards, or if you call the county office or go to gastongov.com and pull up our care plan, it'll help address that.
When does the signing happen?
It can happen here in a minute. So.
Andrew, are we getting any questions from any of the reporters in on WebEx?
Not at this time, no.
Thank you, ma'am. Any other questions for any of our panelists at this time? If not, we'll conclude the press conference. We have all the documents available to the reporters in the room. We'll be sending those out electronically as well. Thank you so much.